What is PDA? PDA was first described by Elizabeth Newson in the 1980s. It refers to a pattern where individuals, usually children, show an extreme avoidance of everyday demands. These demands can be simple tasks like brushing teeth, getting dressed, or following instructions. What makes PDA distinctive is that avoidance is intense and persistent, not occasional. Children may invent elaborate or unusual excuses to avoid tasks. They may even avoid things they want to do. Key characteristics. Several traits distinguish PDA from more typical autism presentations. Demand avoidance. The central feature, resisting everyday expectations to a pathological degree. Surface sociability. Children often appear socially skilled and engaging, which can mask underlying difficulties. Strong imaginative play. Unlike classic autism profiles, children with PDA often show rich pretend play. Use of social strategies. Manipulation. They may use charm, distraction, or shocking behavior to maintain control over situations. Anxiety-based response. PDA is fundamentally driven by anxiety and a need for control. Everyday life can feel overwhelming, triggering fight, flight, freeze responses. Need for control. Maintaining autonomy is crucial. Loss of control can lead to distress or escalation. Diagnosis challenges. PDA is not officially recognized in diagnostic systems, creating difficulties. Clinicians may hesitate to diagnose something not in formal manuals. There is no single standardized diagnostic tool. Conditions like attachment disorder can look similar, complicating assessment. Although tools like the Extreme Demand Avoidance Questionnaire exist, they are not definitive. There is also ongoing debate. Some researchers see PDA as part of autism. Others argue it may be a separate condition. Cognitive profile. Children with PDA are often bright and articulate, strong in language and vocabulary, without learning disabilities in many cases. This can create confusion, as their abilities. Understanding PDA or pathological demand avoidance can feel like navigating a complex landscape, but it begins with a few core principles. Our first goal is to reduce pressure. This means avoiding direct demands whenever possible and instead offering choices. Giving options helps maintain a crucial sense of control for the individual. We must collaborate, not command, using negotiation rather than authority. For adults, staying calm and regulated is critical. Emotional escalation only worsens the situation. It's vital to reframe behavior. What often looks like defiance is, in fact, an anxiety response or even a panic attack. Flexibility is key, as strategies that work one day might fail the next. Ultimately, understanding over-control, coupled with patience and empathy, are our most important tools. You might encounter challenging behaviors. Children using shocking language, trying to provoke emotional reactions, or strongly refusing. These are often control strategies, not intentional misbehavior. As adults, we're encouraged to switch off the offended button, avoid reacting emotionally, and stay neutral and calm. In educational settings, PDA presents significant challenges. Standard approaches frequently fail, and teachers often struggle to adapt for one child. Training for staff is essential. Support should be viewed as reasonable adjustments for a disability, not special treatment. Children with PDA often express deep frustration at being expected to behave neurotypically, which can feel inauthentic and distressing. Many also experience sensory sensitivities and speech and language differences, meaning avoidance can sometimes be linked to rational sensory discomfort. It's worth noting that some individuals dislike the term pathological, finding it negative or overly medicalized, preferring alternatives like extreme demand avoidance, as many behaviors are logical responses to stress and environment. PDA is complex, evolving, and not yet fully understood. Clinical knowledge is currently ahead of research, and families often struggle to access appropriate support. The most effective approach centers on understanding, flexibility, and a deep respect for autonomy. The key message from individuals with PDA themselves is profound. Respect us as we are and give us a sense of control.